if you're interested in how hearing loss may affect your brain, this article is for you. So today we're talking about relationship and the correlation between hearing loss and your brain. We found this article, and it's published by Health News. And this one is actually put out by USF, University of South Florida. It says they did a health clinical trial that reveals how hearing aids improve brain health and overall quality of life.
So this is cool. This has been a topic of study for maybe a decade or more, this idea that hearing aids can impact brain health. And it gets talked about a lot. A lot of people come into our clinic now already kind of having heard a little bit about this. So this is just one of several recent studies that have tackled this topic. And in this particular one thing that I really liked about it is that they were looking at individuals with mild hearing loss.
They don't get a lot of attention.
No.
I mean, in school, little ones, going through the academic process, maybe they're just in elementary school, individuals with mild hearing loss often go undetected, and they have the biggest issues in school because they look like they're getting by. They don't seem like they have an issue, but they have an issue.
And I remember too in school, I remember being taught in my pediatric audiology courses that even a slight to mild hearing loss in a child can really impact their educational abilities, and it can be really detrimental to them with a mild hearing loss. But sometimes adults...
Fast forward now to 55. They were looking for 55 to 75-year-olds.
Because I remember even then in school thinking, boy, they really think that if a child has a mild hearing loss, we need to be aggressive at treating it. But then for adults, mild hearing loss didn't seem like as big of a deal. But what we're finding out is it is a big deal for adults too.
These individuals were specifically looking for these criteria. They were looking for how does this mild hearing loss, if treated, affect their communication, their physical health, their mental health, and overall well-being. So that was kind of the four-headed monster they were going after to see how does this affect their total, well-being, their physical health, their mental health, their just how they communicate with others. So,
which is kind of cool, right? Because we're interested in the whole person. We understand as audiologists that hearing impacts many aspects of an individual's life. So this is a cool study. Patients with mild hearing loss who received hearing aids along with education, counseling, and self-management support. Which, by the way, that's cool to note that these people aren't just getting hearing aids. They're not just getting shipped to them. They're not getting over-the-counter devices. This is someone who's getting proper care from a doctor of audiology.
Education, the counseling,
all of that, which is so important. We've talked about that.
What do you think people with mild hearing loss think about their problem? It's not too bad.
That's what we hear, right?
What could these hearing devices possibly do for me, right? I mean, they have to be saying that. In fact, that's a quote from one of the participants, this Mrs. Goodwin. She's like, I was a little skeptical, like, what's it really going to do? And she says, I'll try this out, but I do have reservations that hearing devices could really possibly help me with my relationships with my friends. I mean, my problem's not that bad. She's minimizing this mild loss because it's just mild.
And that's what our patients do.
So really quick, let's define mild too.
Oh, okay, let's do it.
So mild hearing loss, we're looking at an individual that has in this study, they wanted 30 decibels of hearing loss or better. So not anything over that. And really mild could stretch up to 35 decibels if they wanted to.
Maybe even 40.
Close to 40. And 40 does usually start a new criteria of hearing loss or a new a separation as you designate how severe a person's hearing loss is. It becomes a little moderate. So, but they said if you have hearing loss that's around 30 decibels, we want you in this study. So they tested a bunch of people. They've got a good number of participants, and these are some of the quotes. So they just feel like it's not that bad. I mean, sure, I'll do this.
But like we said, the results were dramatic. So if I continue, I like this paragraph. It says these patients reported a myriad of benefits. Many patients say they experienced an increased desire to engage in the world around them rather than withdraw, becoming more physically active, and feeling happier overall.
Jubilee. I know. It makes us happy just thinking about it.
I mean, these are good. These are not just hearing-related things. Happier overall.
That sounds amazing. And what about this idea of having a little more physical, like a little pep in your step?
Yeah, feeling better.
So it's documented, and if you look up hearing loss and fatigue, or fatigue related to hearing loss, things like that, there's a lot of really good, well-documented studies that look at the effects that hearing loss has on our overall levels of energy and things like that. So I'm glad that they mentioned that. So pretty cool.
It'll be cool to see this article come out and see some of the actual data. A lot of the article does have kind of anecdotal quotes, people, kind of just sharing their own experience, which is really fun to hear.
Her very quick, brief testimony was, she never dreamed. Ooh. So she's happy, she's dreaming. She never dreamed of how much she was about to gain. A significant change in her ability to pick up bits of conversation she previously was missing, and a greater sense of connectedness with the people around her. So we certainly see that often, that the thing that individuals come in and they say, I want to try hearing devices, is for one reason. It's not usually because they want more energy, because they don't even know about that. It's not usually because they think it might help their balance. They don't really understand that. It's not usually because they think that they're going to have just an overall happiness about them. They usually come in and they say, I need to be hearing and connecting with those around me. I need to improve my relationships. It's all about relationships.
Yeah, I thought you were going to say, I'm here because my spouse dragged me here, which we do here, but actually that's a similar point.
Right.
Because that relationship with the spouse is usually the most important one that a person has in their life. And as you're talking about relationships, even though we joke about it sometimes, like, she dragged me here, or, right. The truth of the matter is, when you have hearing loss, it affects your relationships.
Yeah.
And it affects your relationships with the people that you are close to the most. So.
Absolutely. I love this other quote here coming from the Dr. Sanchez. She said, because patients are hearing sounds more clearly, they are able to fully participate in their activities, adapt better to challenging environments, and have a better sense of self.
Just makes you feel good.
Yeah.
The Jubilee.
I know. And I just think, who doesn't want to be a full participant? Because we want to be full, card-holding members, right? We want to be full benefits. We want to be able to really get the most out of life, and you just kind of get this feeling. She says they were more confident and can mentally and cognitively engage more efficiently and effectively. So being more efficient in how you're thinking through things are coming to you easier, things are coming to you with greater speed. That's the efficiency part. But I love that there's just this idea that individuals would have a better sense of self, both physical and mental. And I think as people age, you and I are in that actually.
We're aging.
As we're aging men over here, middle-aged men. As we're aging, you're thinking to yourself, how can I be better physically? And I certainly don't want to end up like grandma or grandpa. I want to make sure I'm taking care of my brain. So this mild hearing loss discussion's a great one.
It really is. And they get into something that I think is cool, because we deal not only with hearing as audiologists, but we deal with balance, we deal with equilibrium issues, dizziness and vertigo. And this article touches on something that's kind of cool, that the fact that hearing aids can actually sometimes improve balance.
Let's talk about that.
This is cool.
Yeah.
It says right here, sometimes people are so focused on hearing that they may not notice that their feet could be tripping up. They're exerting so much energy just straining to listen and to hear. It takes some of our energy when we're not hearing well. That exertion of sometimes I call it squinting with your ears.
Right.
If you can't see, you really have to strain to see something.
And in other articles, when you research it, you can type in the word cognitive loading and hearing loss, and it speaks to what you're talking about. You're loading up one area of your brain. You're trying to manage this so much. The other areas of your brain aren't getting enough attention.
Yeah, so it takes some of your energy, takes some of your focus away. Have you ever stopped walking to concentrate on a conversation? You might be walking along and someone says something, but you have to stop and really focus in. Or stop moving to think through a difficult problem. People with normal hearing do this. They focus their cognitive resources and mental power on the task at hand. So think about that for someone who has hearing loss.
Very, very good point. And that's the physical part, right?
Yeah.
Jumping in there a little bit.
And so wearing hearing aids actually can decrease that cognitive load. It can actually help you focus on other things. And one of those things can be balance. It can be being aware of your surroundings, being aware of things around you. And I tell my patients often that although hearing aids' primary function is to help you hear better,
That's right.
they have other benefits, and one of those benefits is to help with balance.
That's right. So we talk about, in the study, it outlines this very nicely, and we talk about these same themes with our patients, but social awareness, being aware and being present, not just being a passive person, but being an individual that's actively participating is enriching.
Yeah.
It's fulfilling. It's fun to be part of the conversation. It's fun to be part of the narrative and be part of the problem solving and different things. And so there's that, you feel this feeling of being very enriched and having a social presence where you are, you're important. You have meaning in this dialogue. And I think that's a huge one. So we have the physical, we have these social parameters. They outline here that many of the participants said that they admit that sometimes socially they say, well, I just don't want to engage in that, or I don't want to participate in that because, again, I'm not doing as well as I thought. And she points out, don't wait until you're 80 years old to find out, is this you aging or is this just hearing loss? Like, just because you're getting older doesn't mean that you should be like not doing well in life. Go seek it out. Go see what you can do to improve that.
I love that quote. Yeah, I was looking for that quote. It's a really good one. But I love that. Don't wait until you're 80, it says, because it's going to happen. Hearing loss for almost all of us is going to happen.
Yeah, there's a high percentage of individuals, obviously, that have hearing loss that are 80 and over. But it's interesting how many individuals have hearing loss that are 70s. That's a decade sooner. And how many individuals have hearing loss that are between 60 and 70. And so it's going to happen. And it's slow. It's a slow process.
And because it's slow, when you just have a mild hearing loss, that's usually the beginnings. So often you might be in your 50s or 60s, kind of young for thinking, boy, I might need hearing aids. But this is a really cool article. Thank you, University of South Florida, for participating in this, because there are benefits emotionally, there are benefits socially, there are benefits physically beyond simply hearing better.
And of course the mental. Yeah. So there's amazing benefits there. I love that they talk about it. She talked about how important it was that she felt she did well because she had the proper and professional fit. It felt good. It was physically appropriate. It looked appropriate. It sounded appropriate. Obviously those first couple of weeks can be challenging, but when you're getting the right education, when you're getting the right counsel, and it feels good, you're going to be more successful. So doing it the right way probably means quite a bit, and it's pretty significant in the overall experience of doing well with hearing health is having it done the right way.
This is a cool article because many people wonder, are hearing aids really worth it?
Right.
Is the juice going to be worth the squeeze with this?
She says here, Mrs. Burnham says, it was a wonderful experience.
Yeah, and we see that as doctors, but we also see people go from this skepticism to realizing, oh, this is good. I should have done this earlier. This is actually a good thing for me. And it's nice to see that this study is being done to actually document it. It's not just anecdotal collection of stories. When the study is published, it'll be fun to look at the data that they've collected and to be able to see that, this really does improve quality of life.
Yeah. Here's a fun quote maybe to end. This Mrs. Bocott said, but here, the remarkable piece is that even in these folks with mild loss, they report feeling like a different person. How cool is that?
Pretty cool.
Yeah, fun to have and be a part of life-changing experiences. We see it all the time. But if you're wondering if you might have a mild loss, or if you're starting to kind of miss bits and pieces here and there, and you can tell others aren't missing those pieces of the conversation, we invite you to be part of the conversation, to get your life back, literally. The social parts, the physical part, the mental, the intellectual part, all of it is so important, and we love to help, but just get your hearing tested, find out where you're at. Okay, everybody, we so appreciate you watching the video today. If you've liked what you've seen, please like it, subscribe to our channel. It means the world to us, but it also means the world to other people who are trying to figure out what's going on with their hearing health. So thank you for watching.